in place in the Bay Area. Doctor visits are going virtual. And joining us now by FaceTime is Dr. Maja Artandi with Stanford Healthcare, here to talk about telemedicine. Thanks for joining us virtually. First of all, let's talk about telemedicine. Tell us exactly what it is.
So when we talk about telemedicine, we are referring to providing medical care through a phone visit or a video visit. In a video visit, the patient and the provider see each other on the screen, just like you and I see each other on the screen right now. It's just like FaceTime. However, the difference is the visit is going through a secure platform so that the patient's privacy is protected. Patients can do video visits if they have a device's internet access and a camera, just like a smartphone or a laptop.
So how has medicine changed because of the coronavirus epidemic?
So when the cases of COVID-19 in America started to rise, we realized that we needed a way to take care of our patients that was safe and effective and protected them from being exposed to the novel coronavirus. And video visits, telemedicine is exactly that way. Stanford did an amazing job to rapidly increase the access to telemedicine. In Stanford Express Care, where I work, in the first week of the pandemic, we changed our available visits 80% to video visits. And then within the next 3 weeks, Stanford Primary Care changed more than 75% of their visits to video visits.
So what are some of the advantages of telemedicine?
So telemedicine has a lot of advantages. Patients don't have to take time off work. They don't have to look for elder care or child care. They don't have to drive to the office. I have patients who drive 3 hours to get their care at Stanford, and that is a long drive. They don't have to pay for parking. They don't have to look for parking. So having a virtual visit with a provider is really a big time saver. And what's also really important right now in the COVID-19 pandemic, having a virtual visit protects the patient and the provider from being exposed to novel coronavirus.
Absolutely, a lot more convenient. But I'm sure there are some disadvantages to doing a video chat because you can't be there in person. Can you talk about those?
Yeah, actually, there are a few disadvantages of video visits. Number one, we really have to rely on the internet. If we have a bad internet connection, then the video visit is not as pleasant because the picture can freeze, the audio is choppy. So having good internet connection is really helpful. Also, patients who are not comfortable with technology often have a harder time doing a video visit. Patients who have problems hearing or patients who need a translator also have a harder time. And then you're completely right. Through a video visit, I cannot do an in-person exam. That means if I think that a patient looks poorly in a video visit, I still have them come into the office so I can measure their blood pressure, check their pulse, their oxygen saturation, listen to their heart and their lungs, and potentially get an EKG. So sometimes, even though patients do have a video visit, they still have to come to the office to get the best care possible.
Yeah, what can a patient do to actually improve that telemedicine visit?
Patients can do a lot. So number one, again, make sure that you're in a place that has good internet connection. And then number two, really important, stay safe while doing a video visit. I actually had patients who were driving while they were doing a video visit. And of course, that is really dangerous. So I told those patients to either pull over or hang up immediately and call back later. So please never, ever drive while doing a video visit. Now, the thing is that, sorry, I need to say that, but it's really important to also be in a private place because you're potentially sharing really important confidential information with your provider, and you don't want to have a bunch of curious people around you who want to listen to your medical history. So that's also really important.
Yeah, absolutely. So how do you examine patients in a video visit?
We ask the patients to help. We do a so-called provider-guided patient self-exam. So that means that the provider is guiding the patient through the exam maneuvers. So I can ask a patient to look at the back of their throat, examine the lymph nodes on their neck, look at the mobility of a joint that's painful. It's really impressive how many exam maneuvers we can actually do that way. And the patients really enjoy it because it teaches them something about their own body.
Now, when should you not book a telemedicine visit?
If you think that you need a procedure, for example, if you cut your finger open and we need to suture, please don't come for a video visit because you will need to come in person. Also, if you have an abscess that needs to be drained or a tick removal. And then really important, if a patient has chest pain, shortness of breath, is passing out, a video visit is really not adequate. Those patients need to go to the emergency immediately.
Great information, Dr. Maja Artandi. Thank you for the work that you do and all of your healthcare providers at Stanford Healthcare. Thank you so much on behalf of KPIX5 and CBSN Bay Area. Thank you.
It's a pleasure. Have a wonderful day.
You too. And every Monday here on CBSN Bay Area, we have tips and advice from Stanford Healthcare. Stay with CBSN Bay Area for a new topic next week.